Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. So today I'm actually flying solo to bring you a topic of discussion that rarely sees the light of day. But with the client base that the NSCHBC has and our listening audience, I felt it was time to shed some light on a particular topic. So most of you may know I'm a coding, billing, and reimbursement consultant and auditor, and I deal primarily with the professional fee side of revenue cycle management. So that's the physician side instead of just the facility. And there are some crossovers when we talk about medical billing when we add dental providers into the mix for medical billing. But not all dental is considered medical, and I wanted to shed some basic light on that for those of you that are in those spaces or maybe in both spaces or maybe be looking to venture out. Especially, I know sometimes the dental side, they don't always know if they have an opportunity to be able to bill something in the medical insurance side or if they have to stick with dental. So I just wanted to really bring this question to light today. And there are not a lot of consultants that are willing to tackle this. That's why I'm going solo. I tried to find a couple, but we'll see what happens here. And hopefully you'll just find this information, as narrative as it is, helpful when you're really considering what the next step is for you. So the basic question for today's episode is, are dental billing and medical billing the same thing? I should say, is it the same thing? Yes, dental and medical billing are very similar. They are both parts of practice management, but the procedural aspect is different. So for example, the dental biller's job description will include instances when they must consult with their dentist. Similarly, a medical biller may be required to read up on treatment plans to ensure proper coding and billing, and also those pesky little prior authorizations. So the two have the following features in common. In both methodologies, you must understand the fundamental principles and how insurance companies admit and process claims. Both billing processes require proper communication with insurance companies. You also need to know what your policies will allow or won't allow. You need to have an in-depth patient demographic data. That is really required to see if your patient population is something you want to venture into to basically hit the fringes sometimes of those claims policy. Both billings require information about submitting claims, including the correct codes and communicating again with insurance companies. Now that we've covered the differences between dental billing and medical process, let's look at the distinctions. So when it comes to dental coding, a diverse set of data is used in sending claims and compiling the coding process. In this regard, medical billing and coding are distinct. Medical coding is determined three factors: ICD-10, CPT, and HCPCS codes. The American Dental Association publishes a considerable text called Current Dental Terminology, which is used in dental coding. As a result, the inclusion of codes differs in both medical billing processes. So you must handle the codes carefully to receive productive reimbursement in both cases, otherwise you're going to get denials. Dental billing and coding claim forms are used like other medical claim forms. It's called a J400, and that's the name of the dental claim form. This document includes all pertinent information regarding patient demographics, service provision dates, patient insurance coverage, and dental codes. It also provides information about the provider, such as a treatment place, fees, and identification. Dental claim forms require a large amount of information. The data may consist of specific tooth surfaces, details about missing teeth, procedure explanations, etc. This information is linked to the patient's dental procedure specifically. Dental insurance is distinct from your overall medical insurance, and as we know, not everybody has it, so you have to be very cognitive of that. Dental insurance is generally proactive, where medical insurance is reactive. So medical insurance is intended to be used after you have a health problem that's arisen, where dental insurance is primarily concerned with preventing such issues in the first place. Now, that's not to say that you don't have preventative coverage under your medical insurance, but it's kind of just a factor that we deal with. You know, we're getting a teeth cleaning, or you're going in for preventative, typically services. Patients who do not have proper insurance, you're not going to get reimbursed to the provider, let's say, and have to pay for a lot of, healthcare services they received. As a medical coder, biller, administrator, you must be aware of the patient's insurance coverage and properly integrate it so you understand it. Most patients believe that their insurance policy includes dental, believe it or not, or they have everything. Medical insurance, they feel that most likely they will pay the bills if the patient receives dental care to a medical problem, and sometimes it will. The patient must discuss that with the dental billing and coding departments to figure out if they actually have coverage for dental services. And again, there is a gray area there, and I'm going to try to give you this in Medicare terms. So a question that I get frequently, does Medicare cover dental? The quick answer is no. Traditional Medicare Parts A and B generally does not cover dental. However, there are some exceptions. There's always exceptions to the rules. And one of those exceptions could be a Medicare Advantage plan. Now, I know a lot of people frown on this. I mean, even some of the threads I see on different websites that I belong to or organizations that have listservs, they always say that, Medicare Advantage isn't great. I think it's great for some things. They do offer some dental coverage as part of their benefit package. It's great for patients who aren't sick, who really want well services, want gym memberships, want, a stipend every month to get their toothpaste and things like that. It also sometimes can be very helpful when it comes to out of pocket. It can be a lot less, but if you're really sick, Medicare Advantage may not be for you. Dental services related to medical conditions. Now, this is where the exceptions are. Medicare may cover dental services that are medically necessary for the treatment of an underlying medical condition, such as extractions before radiation therapy or dental implants after a jaw fracture. But see how it's tied to that medical condition. It's also important to note that even if a Medicare Advantage plan offers dental coverage, there also may be some limitations or exclusions. So the plan may not cover routine dental checkups, and definitely I haven't seen them cover cosmetic procedures. So if a patient is considering getting dental care and they have Medicare, you need to recommend to them they contact their plan, especially if they have a Medicare Advantage plan, to really determine what their coverage options are. Because in most cases, Medicare and Medicare Advantage, again, doesn't cover dental services like routine cleanings, fillings, tooth extractions, or dentures. So when we talk about what they may cover, again, let me just kind of go over that. So if certain dental services, when they're admitted to the hospital inpatient for a dental procedure, because they have an underlying medical condition or the severity of the procedure, specific inpatient or outpatient dental services as it relates to a certain covered medical treatment. Again, oral exam and dental treatment before you have a heart valve replacement or a bone marrow, organ or kidney transplant. Those are really important, especially when you're dealing with certain anesthesias, et cetera, and possible infections. A procedure like a tooth extraction may not be covered from a routine, but to treat a mouth infection before you get cancer treatment, like services like chemo, that would be covered. But I'm hoping you're seeing the nuance here and what needs to be well documented and probably authorized first. If you deal with the treatment for complication the patient's experience while getting head and neck cancer treatment services, that also may be covered. So it's really important to know where the crossover is from dental to medical, and just really keep those things in mind, because then you would be in a different part of the patient's insurance coverage. So you're used to just getting their card for their dental coverage, but you would also need their card for their medical coverage, know their deductibles, their copays, and the patient would need to know what their out-of-pocket is. So just to kind of finish this up, and I hope that was really helpful. It's going to be a short episode today, but I just wanted to kind of give you some insight if you're wondering where to go with that. It's really up to you and your staff to check and double check coverages and if prior authorizations are necessary, so that you're not stuck with an unpaid claim and the patients then aren't stuck with a surprise bill that opens up all kinds of issues with the No Surprise Act. Remember, no matter the situation, when it comes to coding, billing, reimbursement, always do your due diligence first to determine if it serves your patient population, and always do your due diligence on specific insurance policies and plans. All right, everyone, thank you for listening in today. So we always appreciate spending time with you each month to discuss hot topics on the business side of medicine. You can find me or any of our amazing consultants with the NSCHBC. You can go to nschbc.org and click on the Find the Consultant tab, and we are easily accessible. As a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as quarterly Medicare webinar updates. So twice in March, you get me. On Tuesday, March 25th, I'll be presenting a telehealth free webinar to update you on what Medicare and other payers plan to do with telehealth coverage, because Medicare, right now we're on a 90-day hold of what we can do through we were extended through 90 days through the end of March, and we're going to get an update. We already did get a posting from Medicare, and I'll bring that to you next month. Also, our next Medicare quarterly update, which is all things Medicare, from that quarter is the next day, Wednesday, March 26th. And so both of these would be at 8 a.m. Pacific time, 11 a.m. Eastern time. But for all educational offerings, go to nschbc.org and click on Upcoming Education tab, and you'll see not only our free webinars, our Medicare quarterly updates, but also our conferences that we offer. So again, that's it for me today. Please join me next month, where we once again bring you current and important topics on the business side of medicine. Make it a great day, a great rest of your month, and thank you for listening to this NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.